Pleasure to be here this morning. Devolution and economic empowerment is very close to my heart. And so any opportunity to discuss or to engage in this topic is very welcome. My view is that devolution is working. As you're aware, 7 years ago, Kenya began the journey on devolution. It was a journey that I was privileged to be part of, helping the nation transition from a centralized system to a decentralized system of government. And we had no prior experience previously. Today, public services ranging from healthcare, agriculture, water services, childhood education have been brought closer to the people in practically every county in Kenya. Devolution has allowed each county to address its own unique development challenges and demystified previously held mentality in politics of the winner takes it all. The fact that we have 47 governors reduces the pressure that we have always had in the focus on the national politics, especially for the seat of the presidency. Many of the stories, however, told on devolution focus on the negative, and in most cases paint a doomed picture. This is what the author Chimamanda Adichie refers to it as the dangers of a single story. And we hope that with time and with this kind of forums, that this danger of a single story will change and people will see devolution as it is, that devolution is working and is working to serve the people of Kenya. Using Kirinyaga County as an example, we have developed a 15-year strategic plan, which we call the Mountain Cities Blueprint. This outlines the vision of Kirinyaga in transforming various sub-counties into strategically developed zones. And we did this in a consultative process with the public, identifying the needs of the people of Kirinyaga, assessing where we were, and then drawing a map and a plan of where we want to go. Kirinyaga Central, for example, we're focusing on it becoming a health and wellness city. This is where we will be focusing mostly on building a level 5 hospital and a lot of the interventions to do with health. Mwea is the green city. As you know, it's the largest producer of rice in the region. Ndia into an industrial city, and I will explain why we picked Ndia as an industrial city and Gishugu as an organic city. Those are the 4 sub-counties in Kirinyaga. Each of these 4 areas are based on the challenges and opportunities that were found within our county, but also relate to the national Big 4 agenda. For example, in agriculture, we have developed what we are calling Wezesha Kirinyaga, an economic empowerment program. As an agriculturally based economy, we realized through the process of public participation that our farmers face various challenges in finding markets and better prices for their produce. Through the Wezesha program, we have been able to come up with economic empowerment programs which add and support value addition in dairy, in poultry, coffee, and horticultural crops such as tomatoes, and also other crops such as macadamia and avocado. We're also working with women, youth, and people with disabilities to ensure we deliver an inclusive socioeconomic impact for the people. One of the things that we're doing, just to give you an example of one of our targets, especially when it comes to poultry, we are working to get groups of women and youth to produce 1 million eggs a month in Kirinyaga. And the reason why is we learned that we import about 10 million eggs a month, mostly from Uganda. And we thought that this would be one of the areas that we can focus on, because that shows that we have a gap in local production. And we are looking at the issues of cost of production so that we reduce the cost of the production of eggs, and then therefore, hopefully, especially with regard to the feeds, and then hopefully we'll be able to get into the market and compete with the imports. Under health, we have done several interventions. The first one is with our Kirugwea Hospital. It was in a very bad state when we came in, and we have refurbished it and upgraded it. We've upgraded the outpatient unit. We have set up a renal unit with 8-bed capacity. We have an eye unit in partnership with Operation Eyesight, and now we're in the process of building a new structure completely, 5 stories, to upgrade our hospital and increase our bed capacity from 250 to 500. In Kanaga Hospital, we have built a maternal and child health ward. In Kimbimbi Hospital, a maternity ward. In Sagana Hospital, we have done an X-ray unit and a female and pediatric ward. And in Baricho, we have a male ward. In South Kariama, a promise that I made during the campaign, we have built a maternity ward. And if you understand Kirinyaga, it's a bit far off. We're also in the process of establishing the KiriCare, which is our universal healthcare plan. And we're in the process of registering people. And hopefully, beginning of July, we will launch KiriCare, where Kirinyaga households will pay 1,700 shillings and will be provided with free medical care from all our health facilities. So we improved the infrastructure. We have streamlined the operations of hospitals. And at the same time now, we are moving to seek to provide universal health care for everyone in Kirinyaga. With regard to trade and manufacturing, we have established what we call the Kanaga Investment Development Authority, mandated with the identification and engagement of investors interested with the many opportunities available in the county. We have worked with many partners to identify investments that can actually be set up in Kirinyaga. We have an investor who is setting up a tomato processing plant. We have received support from the British government, where we'll be building rice huts, recycling into wood products, and using that to produce furniture, especially for schools. And then we are also working on other factories such as coffee processing. We've built 5 markets so far, new markets since we came in, and they're functional since we took office, and we have another 3 markets currently under construction. We've also demarcated 250 acres of land in Sagana for an industrial park that will benefit from easier access once, of course, the dual carriageway between Kennel, Sagana, and Marua is complete. Finally, with regard to urban planning and in line with the national program of affordable housing, we are also making progress towards affordable housing. The Kenya Urban Support Program by the World Bank and the SUAID program by the UK Aid has enabled us to work on sustainable development infrastructure in Kirowe and Kutus municipality. And this infrastructure is a critical component towards realization of affordable housing in Kirinyaga and also the development of our urban centers. In conclusion, of course, as with every process of change and growth, there are also some challenges to devolution. I think these are challenges that can be addressed and streamlined to ensure that delivery of public services is not shortchanged at the expense of running government. Those challenges I will not repeat because they have been highlighted by my colleagues, but I would just want to say one of our major challenges is the clawing back by the national government on devolved functions, and especially in areas of health, agriculture, and water services, and that is a matter that needs to be addressed if devolution is to succeed. Lastly, devolution has expanded the leadership space in Kenya, and we must support the participation of more women and youth in leadership at all the different levels of government so that we can benefit from a more representative face of Kenya. Thank you.
Thank you, Anne.